Mellissa Naidoo. Thank you, KP. That seems so formal. Thanks very much. Look, I firstly as well would just like to pay my acknowledgements to the custodians of the land on which we meet, the Turrbal and the Yagara people. I do so because as a doctor, it's very hard for me to ignore the absolute disparity in health outcomes for our Indigenous and Torres Strait Islander people. I know that people place and recognition of that actually plays a huge part in health outcomes. I want to thank Deb as well and PwC for this beautiful space. It's really lovely to be here. It's lovely to look out at that view. And before I start, I just also wanted to really acknowledge and say how much I love the candles on the table. They're really beautiful, and it's really actually made me a little bit tearful reading that quote, because I do think that I've made some amazing friends actually through this journey, which has been really hard, including a couple sitting at this table, which is Rochelle and Mellissa and KP. But I'd also like to probably just go off script a little bit and dedicate this talk to a friend of mine. I'm going to upset myself even before I start. Emma Louise, who I met going through treatment and has metastatic breast cancer. And that's a real challenge for me, being where I'm at in my journey and where she's at in her journey. But she's been a very, very special friend to me. So it's a great honour to be invited to speak today at the Pink Lady Luncheon. I'm actually quite used to speaking at various events as a specialist in my field, and it's often on the topic of leadership or gender equity, which has become a real interest of mine in medicine, having achieved and advocated in those areas. But I have to admit that I'm not quite sure why I was particularly asked to speak today, other than Mellissa suggested it. But when it comes to breast cancer, I actually think my story is a very ordinary one. I haven't done anything extraordinary. I didn't go on to overcome the physical and psychological sequelae and climb Mount Everest. I haven't fundraised significant amounts of money for research, nor did I write a book, develop an innovative product, or found a company that helped fellow sufferers, as many people I know have. In fact, I've actually spent a huge amount of time following my diagnosis and treatment, struggling to find meaning and purpose in my return to everyday ordinary life. But I actually know I'm not alone in that, and I'm no different from the majority of the almost 20,000 men and women who are diagnosed with breast cancer every year, the approximately 70,000 persons living with breast cancer, and the 1 in 7 women in this room who will be affected by breast cancer, which is almost 15 people. Because after a cancer diagnosis, the ordinary things in life, the things we take for granted like raising a family, going to work, relationships, whilst bringing renewed joy and gratitude also present additional challenges due to the overlay of fear, grief, loss, trauma, lack of confidence, pain, fatigue, and the underlying physical, emotional and psychological issues, not to mention loss of function and disability. And it's often invisible to the outside world, but they weigh me down and sometimes make my prior ordinary seem like Mount Everest. I was 37 years old when I was diagnosed with inflammatory breast cancer. My daughters were aged 2 and 3 years old. I had recently received my specialist qualifications after a couple of maternity breaks, and I'd returned to full-time work in a job which I thought at the time was my dream job. I finally felt like after years of study, training and having kids, that I was back in control of my life. And then just like that, I wasn't. I had cancer. The tumour was large and had spread to my lymph nodes already. To say I was in shock is an understatement. I was under 40, I didn't have any risk factors or family history. I shouldn't have had cancer. My GP saved my life. Because breast cancer is relatively uncommon in young women, symptoms can often be ignored or dismissed. Inflammatory breast cancer accounts for only about 3% of cancers. It's very rare and aggressive. It can progress rapidly, within weeks to months. It presents a bit like mastitis and is commonly misdiagnosed as such, and I've since learnt that many women are treated with multiple courses of antibiotics before being finally diagnosed, and that loses their precious time. My GP very quickly recognised that this might be cancer despite my young and atypical presentation, and referred me immediately to the breast clinic for investigation. She advocated for me, ensuring that I had an appointment the very next day, and despite my resistance and objections due to work commitments, made sure that I actually went. I can still vividly remember, as I had my mammogram, seeing the image appear on the screen and actually recognising from my training the familiar pattern of calcifications, and I knew immediately that it was cancer. Sitting in the waiting room, I felt numb. Not numb enough to not feel the pain of the biopsies as they tried multiple times to get a decent sample. And then I was sent home to wait for the results. I remember trying to prepare my mum and my husband for the results. Their optimism that the results would be fine when I already knew that they were not. And then I got the diagnosis. The next few weeks were a whirlwind of appointments and discussions and decisions that no one should ever have to make. Home life was in complete disarray, and my toddler girl's behaviour became difficult to manage, adding to our aura. I just looked at my sister-in-law, so that's just sorry. Which added to our already mounting stress. I had chemotherapy then to shrink the cancer before having surgery. Thanks, Katie. Followed by more chemo and then radiotherapy. I worked for as long as I could. Working was such a big part of my identity, and I feared that loss of identity in my career. But I eventually realised that I couldn't keep up trying to be a mum, a doctor, and a patient. I started to lose my hair until it was so thin that in an effort to take some control back, I asked my husband James, who's attending today as well, to shave my head, which he did with the help of my daughters, who both still vividly remember that moment. I gained weight due to the steroids, which in addition to the hair loss and the mastectomy, worsened my self-confidence and body image. I developed painful bilateral plantar fasciitis and was absolutely distraught that I couldn't wear all the lovely heels in my wardrobe. I felt constant nausea and lethargy. We struggled financially to manage our mortgage. We couldn't afford our childcare, but I didn't want to give our positions up because I had so much trouble trying to get them to get back to work. James was self-employed, so the time he took off to support me further impacted our finances. But the routine and the milestones of treatment provided some normalcy, and we had lots of support. Paradoxically, it was the life after I completed treatment that I found the most difficult. After 12 months of treatment, I returned to work. I had ongoing fatigue and difficulty with cognitive processing and recall. The chemo brain that everyone said would go away after chemo stopped didn't. To the outside world, I was a survivor, admired for overcoming adversity and making ongoing professional achievements. But I was plagued with anxiety and self-doubt. I felt like an imposter at work, and so I worked harder, adding to my fatigue. I couldn't get dressed in the morning without multiple outfit changes and constantly seeking reassurance from James as to whether I looked okay, whether you could tell I was wearing a prosthesis and changing multiple times. Then there were the 3 to 6 months of 3 to 6 monthly screening and reviews, additional time off work for appointments, which only added more to the worry about how I was performing at work, especially when I also needed to take time off for my sick kids or other normal things that working mothers have to do. Over the next 4 years, I had countless blood tests, ultrasounds, mammograms, and MRIs, which I'm very pleased that now there's no out-of-pockets for, as well as 4 more major operations, including the removal of a lump on the other side, preventative mastectomy, and stage reconstruction, all requiring significant periods of work, most on unpaid sick leave and with no income protection. Some days it feels like nothing around me has changed. I'm 6 years post-diagnosis now. Feels like nothing around me has changed, but I've changed. And the people around me have sometimes forgotten, but I remember every day. Sometimes feels like life has moved on, but I feel like time moves around me. This year I had a scare with something seen on ultrasound. I crumbled. I couldn't stop the tears from silently flowing as I underwent another biopsy. It was like going back in time to diagnosis day, D-Day. I was on my own because this was meant to be a routine appointment. 5 years post-cancer, this was meant to be a routine follow-up. But after cancer, nothing is ever routine again. And you can't take for granted that things will be fine. There is enormous anxiety and fear associated with this, which spills over into all aspects of daily life. The biopsy results were unclear. They weren't worried, but they were unclear. So I was back to watch and wait. What should have been the all clear and what I was hoping would allow me to move to 2 yearly follow-up and therefore allow me to forget about being a patient in the 2 years intervening actually saw me return from 1 year follow-ups to 3 monthly screenings and reviews again. I was devastated. And it's the cumulative effect of these knockbacks of when things are going well and when they fall apart that I find the hardest. It's not uncommon for us to see stories of breast cancer survivors, especially those who are doing amazing things. They're spurred on by their experience and they're making a difference. But the issues of survivorship are very real, and the ongoing physical impact is often complicated by a multitude of contradicting emotions. Like most younger women, I was diagnosed with a more aggressive breast cancer, with a higher risk of it spreading. Younger women also have a higher chance of breast cancer returning, and are more likely to die from the disease regardless of the stage of the cancer. It's all pretty frightening, really. Due to the aggressive nature, the treatment is also often more aggressive, with long-lasting physical and psychological changes that can affect the future and quality of life. This year I also tore my cruciate ligament and needed reconstruction surgery. Now, in the context and scheme of having cancer, you'd think that's not too big a thing, but it really knocked me for six. I took far longer to recover from the anaesthetic due to the cumulative effects of multiple anaesthetics over time. My rehab was slower due to the prior deconditioning of my physical limitations. And the psychological impact of being a patient again, of being back in hospital, the fear and the post-traumatic stress associated with that was almost too much to bear. All the while feeling that the expectation of my work colleagues and those around me was that I would bounce back within a few weeks like a normal, fit and healthy 40-year-old, because outwardly that's what I appear to be, but obviously I'm not. While the impact of breast cancer is disproportionately greater for younger women, as a younger woman, I also had an extensive support network. My husband was an amazing support, and my children great motivators to conquer this disease and get through treatment. But in addition, I had extended family. I had my mother's group, the school mums and dads, my work colleagues, my husband's work colleagues, my breast cancer support group, and I met Rochelle. My best friend's mum, Lydia, was recently diagnosed with metastatic breast cancer, and she's in her 80s. Elderly patients are often more socially isolated, without the benefits of work networks, school networks, and supports, particularly if they are from immigrant or non-English speaking backgrounds like Lydia is. Ageism can impact the care, empathy, and support they receive. And whilst breast cancer is an area of medicine that is the increasing focus of research and development, trials often exclude older people. And so treatment options is far less for this vulnerable group when conventional therapy has failed. The 5-year survival rate for breast cancer is 91%, but for younger women it's only 88%. And while survival rates have improved, at 37 years old, you kind of expect you at least have a 99.9% chance of being alive at 40. But even when you're 80-something, you still don't want to die any number of years earlier than your life expectancy without cancer. You still have things to look forward to and you don't want to be robbed of them. Working in healthcare, I'm confronted every day with patient stories. And I remember how vulnerable I felt as a patient. I'm highly health literate. I understand how the system works. I had insider knowledge to choose the best doctors. I was cared for by colleagues I knew and I trusted, most of whom didn't charge me any out-of-pocket expenses. I didn't have to even pay for parking because I had access to the doctor's car park. The nurses knew me and had worked with me, and at one stage I was actually the medical director of the hospital I was being treated in, but I still felt incredibly vulnerable. I had complications and things happened that I felt I should have been able to speak up about, but didn't because I was in the vulnerable position of being a patient. So I can only imagine how it feels for the majority of patients who don't have any of those advantages. I am privileged to be in a role where I can influence patient care at an individual and systems level and use my own experience to focus organisations on delivering person-centred care and coaching doctors to maintain empathy and treat each patient as an individual person, like they would their parents or their children. But as a medical administrator, in particular, I also deal with death, with adverse events, with patient complaints, pain and grief, loss and sadness, and it takes a toll. Everything feels much rawer than it did before, and some things hit pretty close to home. We cannot lose sight of the darker side of cancer, despite the stories of survivors, that women still die every day, that friends I went through treatment with have since had recurrences and are living with metastatic disease. And I think BCNA's continued focus on their 5 priorities of faster access to
think someone fell off a chair.
Maybe a
We've
doctor.
got it.